All right, this is Dr. William here with part 5 of our 10-part series. Today we're going to talk about lab work that listens and what the conventional panels miss. So when your standard testing says you're normal, but you still feel broken, it's time to look deeper. So functional medicine reveals those subtle imbalances that conventional labs often overlook. So imagine sitting in your doctor's office, exhausted, foggy, and frustrated. You've explained your symptoms and shared your struggles and waited desperately for answers. And then the doctor looks at your lab results and delivers the crushing verdict. Everything looks normal, but you don't feel normal. You feel broken, dismissed, and more confused than ever. And you end up leaving with more questions than answers and wondering if it's all in your head. This is one of the greatest failures of conventional medicine. It's lab work that doesn't listen. So why do conventional labs fall short? Well, number one, they're designed for disease, not dysfunction. Standard panels, they catch extremes and emergencies, but they miss those subtle patterns that signal declining health long before crisis hits. Then there's normal versus optimal. If your thyroid levels, as an example, fall within that normal range, you're often told you're fine, even though your energy may be crashing, your hair may be thinning, and your mood is just plummeting. So conventional testing, it often looks at isolated markers without considering how they interact or what patterns they reveal about your unique physiology. So think of it like a car dashboard. Conventional labs only light up when the engine is about to explode, when you're in full-blown disease. By then, significant damage, it's already occurred. So functional medicine is going to look at those subtle warning signs long before disaster strikes. The rattles, the squeaks, the declining fuel efficiency. It's going to catch problems when they're whispers, not screams, which gives you time to course correct before breakdown becomes inevitable. So 40% of thyroid dysfunction is often misdiagnosed. People with genuine thyroid issues are told their labs are normal because testing often doesn't go deep enough. 33% of adults have some nutrient deficiency and they experience fatigue, anxiety, or poor immunity, yet their labs show normal. And the majority of chronic fatigue patients, about 65% of them, in fact, have normal conventional labs before the functional medicine testing, which often reveals hidden imbalances. So these aren't just statistics. This represents real people that are suffering in silence because their labs aren't listening to them when they're screaming. So what does the science show? Well, research in the Journal of Clinical Endocrinology and Metabolism revealed that patients experiencing clear thyroid symptoms often had normal TSH levels. However, when free T3 and reverse T3 markers, which are rarely checked in conventional panels, were tested, it was discovered they had significant abnormalities which explain their symptoms. And another study published in the journal Nutrients demonstrated that subclinical deficiencies in magnesium and vitamin D were strongly linked to fatigue and depression. And so these deficiencies flew under the radar of standard testing, and it leaves patients untreated despite clear biochemical imbalances affecting their daily lives. So labs are like maps, right? Imagine you're lost in an unfamiliar city. A conventional lab, it gives you a map with only the highways marked, the major routes, the obvious paths. You can see the big picture, but you're missing crucial details. Functional medicine is going to give you the full map, the side streets, the landmarks, the hidden paths, shortcuts, and the scenic routes. With that complete picture, you're finally able to confidently navigate and find your way home. So your body, it deserves the full map, not just the highways. So here's Alex's story. So Alex was a 36-year-old entrepreneur. He felt exhausted, anxious, and was unable to focus. His thriving business was suffering along with his health. So when his doctor ran basic labs, a CBC, a metabolic panel, thyroid, TSH, the verdict was everything looks normal. Alex was sent home feeling dismissed. When he came to see us, deeper testing revealed low ferritin despite normal hemoglobin, imbalanced cortisol rhythm, and a vitamin D deficiency hidden by a broad range. The end result was with a targeted program and modifications, Alex regained his mental clarity. So why don't doctors run these tests? Well, one reason is insurance companies often only cover basic panels designed to catch disease, not dysfunction. Functional medicine goes much deeper, but it requires specialized training that most conventional doctors haven't received. It's not that they don't care, it's just the system isn't designed for this type of approach. Well, isn't normal just good enough? Absolutely not. Normal ranges are based on population averages, which often include many unhealthy people. These ranges tell you if you're average, not if you're thriving. You deserve better than average. You do deserve optimal health. Now, are these advanced labs safe? Yes, absolutely. They're non-invasive blood, urine, or saliva tests that provide a clearer, more comprehensive picture of your biology. There's no additional risk compared to standard testing, only additional insight and benefit. So here are some of the markers that really matter. When we're looking at thyroid function, we need to be looking at free T3 and T4, not just TSH levels. We need to be looking at the reverse T3 ratio. We need to be looking at the thyroid antibodies and looking at selenium and iodine status. When we're evaluating nutrient status, we need to be looking at ferritin, vitamin D, magnesium, B12, and the methylmalonic acid levels. And then when it comes to stress and your hormones, we need to be doing a 4-point saliva cortisol rhythm. We need to be looking at the DHEA levels, your sex hormones, and your insulin and glucose patterns. So these markers are going to reveal patterns of dysfunction long before conventional ranges or conventional testing will flag a problem. And they might help explain normal labs and someone who knows that something is wrong. So understanding what these optimal ranges are, okay? So the conventional range, this is based on population averages, which often includes sick people. And so this is designed to catch disease, not promote vitality. The functional range, however, this is based on optimal function and symptom resolution. It's designed to support thriving, not just surviving. So for example, conventional medicine considers vitamin D levels above 30 nanograms per milliliter normal. Functional medicine recognizes that the optimal function requires 50 to 80 nanograms per milliliter. That's a significant difference that can dramatically impact your energy, your immunity, and your mood. So here's some practical steps to begin listening. So track your symptoms alongside your labs. If your labs show normal, but you feel off, document it. Create a symptom journal and note your energy levels, your mood, your sleep quality, your digestion, and any other concerns. Patterns will begin to emerge when you start paying attention. Don't be afraid to advocate for yourself. Ask your doctor for free T3, reverse T3, ferritin, vitamin D, cortisol rhythm testing, etc. Request these expanded panels. And if they resist, it's time to seek out a functional medicine practitioner. And look for patterns, not just numbers. So notice how your energy, your mood, and your sleep quality align with your lab values. A number in isolation, it means little, but when you start to see trends over time, it can reveal your body's true story. And most importantly, keep a comprehensive health journal. Keep track of your food intake, your sleep patterns, your stress levels, your exercise, and what your symptoms are over a daily basis. And over weeks, connections between these factors and how you feel are going to start to become crystal clear. So your body speaks in patterns, not single data points. So conventional medicine often examines each lab marker in isolation, and it misses that intricate web of connection that reveals the true story. Functional medicine recognizes the low ferritin plus high cortisol plus poor vitamin D might indicate chronic stress depleting your reserves. Each marker alone may look borderline normal, but together they'll paint a clear picture of dysfunction. So health is not about individual numbers, it's about how all of the pieces fit together to create your unique biochemical symphony. So today's challenge, compare normal versus optimal. So take action today with a simple but powerful exercise. Pull out one lab result from your past tests, be it a vitamin D, a thyroid, a ferritin, those work well, but something along those lines. Research the optimal range for that marker, not just the laboratory's normal range. Now compare that actual result to the optimal range and write down how your symptoms align with where you fall on that spectrum. This simple step is going to help you see beyond the numbers and understand what your labs are really trying to tell you. So here's some real world impact. Now, Sarah, after years of fatigue dismissed as just stress, expanded thyroid testing revealed subclinical hypothyroidism, and with proper treatment, she began to reclaim her life and her energy. Now, Michael's brain fog and anxiety resolved when cortisol rhythm testing showed adrenal dysfunction. Lifestyle changes and targeted support brought back his mental sharpness. And in Lisa's case, chronic insomnia finally made sense when testing revealed magnesium deficiency and blood sugar imbalances. Addressing root causes ended up restoring her deep sleep. So functional medicine testing isn't just about getting more numbers on a page. It's about being heard. It's about validation. It's about having a healthcare provider who believes in your symptoms that are real, meaningful, and worthy of investigation. When somebody finally looks beyond normal ranges and sees you, your unique biology, your specific struggles, your individual story, healing becomes possible. The numbers matter, but what matters more is having someone interpret them through the lens of your lived experience. So here's the missing link. In the conventional approach, we have symptoms, standard labs, everything's normal, no treatment, continued suffering. In the functional approach, we have symptoms, comprehensive testing, pattern recognition, targeted intervention, restored function. The difference isn't just in the test orders, it's in the fundamental philosophy of care. One approach asks, are you sick? The other asks, how can we help you thrive? So you're not a statistic. You're not a number on a chart. You are not within normal limits. You are a human being with a story, a rhythm, and a unique biology that deserves to be understood. Functional medicine doesn't just test, it listens. It connects your symptoms to your biology. It honors your experience instead of dismissing it, and it helps you reclaim the vitality that normal labs have ignored for far too long. Listen, your symptoms are real and your suffering is valid, and you deserve answers that go deeper than everything looks normal. So, find a functional medicine practitioner. Seek out a provider that's trained in comprehensive testing and root cause analysis. Many of them offer virtual consultations. Compile your past lab results, symptom timelines, family history, medication lists. The more complete your story, the better your practitioner can help. And work with your provider to determine which expanded panels will provide the most insight for your specific symptoms and health goals. And once your results arrive, develop a personalized protocol addressing the root causes uncovered by your testing. This becomes the roadmap to optimal health. So don't settle for normal, demand optimal. Now listen, if today's message resonated with you, imagine what becomes possible when you go deeper. In our paid membership programs, we offer advanced lab assessment guidance, interpretation, personalized protocols based on your unique results, and a supportive community of others on the same journey. We offer expert guidance to uncover those hidden imbalances behind your symptoms, and we provide tools and resources to help you advocate for more comprehensive testing. Your health deserves a map that shows the whole journey, not just the highways. It's time to be seen and support your quest for true vitality.